So I wanted to give you a few more specifics around our PPE stock in New Zealand. The Director General of Health, you may have seen, included in his press statement this morning some of the stocks that are currently held in New Zealand. DHBs hold 5.1 million masks, 1.9 million gowns, 2.7 million pairs of gloves, and 60,000 items of eye protection. In addition, the Ministry of Health has a national reserve of 18 million masks. Yesterday, 640,000 masks were released from the National Reserve, and today, I'm told, were sent to DHBs to replenish their stocks. Over the next month, the Ministry of Health will be supplying 4 million masks to the health sector and a further 4 million masks to non-health sector essential workers. We're also working closely with a Whanganui-based manufacturer of masks who, helpfully, in New Zealand, produce 60,000 masks a day and 45,000 what are called N95 masks. Those are masks specifically used by our health workers and the next level above the surgical masks that you might see day to day. We are actively assisting them, I'm advised, with distribution logistics so that they can focus entirely on production. The Ministry of Health is compiling a priority list so essential workers at the most risk of contracting COVID-19 receive masks and personal protective equipment first. DHBs are being given refreshed guidance on the appropriate clinical use of PPE to help them plan usage and ordering. As you may have heard me mention yesterday, we still have some work to do with the distribution aspect of PPE, but I know that this is a priority for those who are leading our response operation and will include the normal supply networks and working with new private sector support to just continue to grow our PPE stocks. I also wish to follow up on some of the points that Director General Ashley Bloomfield made earlier today about the continued rise in the number of COVID-19 cases in New Zealand. As I have said many times before, sadly, an increase in cases is expected. In fact, it is the whole reason why we are in a lockdown. What we are seeing now are the cases already in New Zealand before that lockdown started, and these will keep showing up each day and will continue to rise for at least 10 days or more, and I'm expecting that those increases will continue to be steep. However, if we keep to the lockdown rules and limit our contact with others, we should start to see the impacts of that, if we follow the rules. I want to remind people again why it's so important. If you today have COVID-19, you may not know that for several days. Say in that time you decide to walk with a friend, not in your bubble. That friend then visits a family member, not in their bubble. That sets off another chain of transmission that will still be showing up weeks from now. So I say again, please stay home, break the chain and save lives. I also want to use these briefings to draw attention to and acknowledge some of the extraordinary efforts essential workers are undertaking in the fight against COVID-19, and there are many unsung heroes across New Zealand. I will do my very best to acknowledge just some of them as much as I can. Today, I want to single out our medical lab scientists, a workforce of 1,823 at 8 labs across the country, processing incoming tests 24 hours a day, 7 days a week to get the job done. They're on separate shifts and separate teams and on rotating rosters to help preserve physical distancing and stay safe as they carry out this vital work to help in the tracking, tracing and elimination of COVID-19. And while their work is around the clock, it is also continually notching up our gear. As testing ramps up, which in the last 7 days has averaged 1,479 tests a day, so too must our labs, with 3 more currently being set up. These lab staff are working tirelessly to ensure we know the true scale of the outbreak and to ensure those with COVID-19 know and get the appropriate care. I want to say on behalf of New Zealand, thank you for your work.